So, have you decided if you're going to do online therapy or in person therapy or hybrid? If you've been wondering about that question, then I want you to stay tuned. So, let's talk a little bit about what the idea of hybrid therapy is all about, because this is a name that's being tossed around so much right now because of the day and times that we're in. So essentially, hybrid therapy is going to be that connection, or basically the in-person therapy with the online therapy that you're doing. So right now, a lot of people, especially when you're working with agencies or different companies, they're finding themselves as a therapist seeing clients online virtually through like an EHR HIPAA compliant program or platform. And then they're also finding themselves in the office, or be it like a clinic or something of that nature. So when you're looking at doing hybrid therapy, you're looking at doing both in-person as well as online therapy. Now, some people don't like this idea of doing both, but there are some benefits and there are some downfalls to doing hybrid therapy method. So where has all of this come from? Really, telehealth has been around even before the pandemic, but after COVID-19, it boomed. It really upscaled and became a thing of the norm. So what happens is, obviously, a lot of us were not able to see our clients in person, or clients were not able to be seen in person. So the nation had to come up with a way in order to still be able to provide the services that the clients need, but not in person. So it can make sure that we're all safe, right? As a result of that, I think a lot of people initially thought that it was going to be something that was kind of just a spur of the moment thing, or just a fly by night thing, but it actually ended up being something that we now see as a norm. Now, the thing that's happening is that a lot of people are starting to transition into in-person therapy, and because of that, we now have the hybrid therapy approach. Now, if you're in private practice, you may be trying to figure out what's going to make the most sense for you, because where we're doing online therapy, we obviously have to pay for an EHR platform, and that's going to cost money for that. But then if we're in person, then we also have to pay for the office space. So then what do you do with that? It's a lot of things that you have to already think about for both platforms. So what's the best option? And that's what we're going to be talking about during this series. So what I want to focus on today is just the importance of the hybrid therapy approach. Of course, we know that it provides a lot of flexibility for both the clients as well as the therapist. So if a client is not feeling well that day, where typically they may cancel because they're not able to leave their home, or they're just not able to go to the location of where the therapy would be held, now they can actually just make a phone call, have a virtual session, and still stay compliant with their therapy. So this also helps to increase the probability that the person that's working on their goals are going to actually be able to meet their goals, and even quicker. And there's no disruption in their services. So that's also going to improve their symptoms. On the flip side, the same thing happens if you are a therapist and wanting to do online therapy. So if you are a therapist and you have, let's say you have an appointment that you have to make, and because of the location, you would not be able to have your session and then be able to go to that appointment. Now, because you're working from home or wherever you're working from, you may have a little bit more flexibility in terms of doing other things that you need to do within that same time frame that you would typically be traveling in. So it also offers therapists a great option to be able to meet their clients, still be able to continue getting their income that they were looking for, but also be able to make the appointment that they had to make. And we don't want to forget the fact that now, because of telehealth, we have the option of being licensed in multiple states. You can see someone from one end of the United States all the way to the next side of the United States, and even within the same states. One of the states that I'm licensed is in New York. New York is huge. So where I'm located, I can actually be like 6 hours away from someone that's in the same state. But because I now have the option of providing telehealth services, it allows me to be able to meet more people. And the same thing for the client. They're grateful that they have the option to see people all over the same state, because perhaps in their particular location, there's not a lot of therapists that they could see. Well, some people may think that you can't really maintain the same level of documentation like notes or intake assessments or pre-screenings, but you actually can do the same thing when you're doing online therapy. So this also offers that option. And the other part for the client is that they're in their home environment. So this gives them the opportunity to feel a little bit more comfortable. And so you're able to kind of break down some of those walls and those barriers that people often feel when they're starting therapy and when they're in an office space. And when you're offering a hybrid option, this also gives your client the opportunity to decide what best fits them. So there are some people that prefer to be in person, so that may actually work better for them. So then that way you can have some clients that are seeing virtually who don't want to come to the office, and you still get to see clients that want to be seen in person. So stay tuned for the rest of this series, where we're going to be talking about the challenges of the hybrid therapy approach, as well as how to actually implement it in your schedule and in a practical way. So if there are specific questions that you have regarding the hybrid therapy approach, be sure to leave a question in the comments and I'll get back to you as soon as possible. Take care, Authentic Therapists.